You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Yes, we can.
Yeah. Awesome. So thanks for having us tonight, guys. My name is Dinesh. I am one of the current chiefs. With us tonight are the two other chiefs, Priya Kalik and Chris Andriano, as well as two of the PGY 3 residents, Shelby Crawford and Michael Pham. So feel free to ask questions in the chat along the way. And once we're done, we'll open it up to discussions. You can hear from a few of us as residents, but we wanted to take a little bit to kind of walk you through our residency and, still living in this pandemic / post-pandemic time. We wanted to kind of do our presentation kind of like a tour so that you guys got a feel of our program. So we'll kind of walk through the hospitals we work at, kind of spend a little bit more time discussing our rehab floors, our overall experience, and talk about us as residents. So our main hub is at the Rehab Institute in Michigan, in downtown Detroit, but we do consults at the Detroit Receiving Hospital, which is a trauma hospital, our Karmanos Cancer Institute, Harper Hutzel Hospital, where we see quite a few cardiac patients as well as ICU patients, our Children's Hospital of Michigan, and our VA hospital, where we do 2 months of EMGs. In terms of our Rehab Institute of Michigan, or RIM, it's a 69-bed, CARF accredited and JCO certified inpatient rehab unit. We have an outpatient clinic, outpatient pain practice, interventional spine, multiple therapy gyms dedicated to illnesses, whether it be TBI, spinal cord injury, whatever the need may be. We have a pretty robust interdisciplinary team. We have an affiliation with our freestanding children's hospital and multiple off-site outpatient clinics, not only in the Detroit area, but also in some of the suburbs to see diversity in our patient population. In terms of kind of walking through the main floors of the Rehab Institute, on our 6th floor, you're going to be working with our program coordinator, Dr. Ajaluni. This is our dedicated brain injury unit. It is a locked unit with 24/7 video monitoring. We work very closely with our neuropsych department with evaluating patients with post-traumatic amnesia and when they emerge. Something pretty unique to our residency program is that we take patients who are minimally conscious. And we have a lot of assistive devices that our therapy can use, including 0G. Here's just a few images from our therapy gym for our brain injury patients. For our 4th floor, that's usually our general service floor, and we have some overflow of our stroke patients there as well. We have a pretty robust general service. We take critically ill patients with LVADs, transplants, critical illness, myopathy, and neuropathies, post-COVID debilities, amputees, burns, major traumas, neurological disorders, and arthritides. For our 3rd floor, it's our dedicated spinal cord unit. We have a pretty comprehensive inpatient and a very smooth transition to a comprehensive outpatient SCI program here. We work pretty closely with urology and our wound care nurses and internal medicine to manage these patients. And we provide quite a lot of education while they're here on the spinal cord unit. And we have a mentorship program where pre-pandemic, before they get ready to go home, we would take a few of them out to our bowling alley, which is located around our Rehab Institute of Michigan. And they get to meet people living with spinal cord injuries and kind of just talk about reintegration into the community and kind of getting honest answers and how they can actually live outside of a hospital after their acute illnesses and their acute injuries. We hope to be getting back to that soon as all these restrictions start to lift. In terms of our 2nd floor, that's mainly our outpatient spinal cord program, as well as a few gyms for our inpatient spinal cord program. There's a lot of therapeutic modalities, including exoskeletons, a variety of those that we use here. We have a wheelchair seating clinic, recreational therapy, adaptive sports. We have a wheelchair basketball team. And then we have this affiliation with Delta Airlines. So if a patient needs to get on a flight pretty soon, we can help them in terms of how to purchase a ticket to meet their accommodations. We'll actually take them out to the Detroit airport, get them on a flight and get them off a flight so that they feel comfortable, confident, and have less anxiety about what they need to do to meet their accommodations for their upcoming flight. Here's a few other pictures from that 2nd floor spinal cord gym. In terms of our outpatient clinics, we have an MSK outpatient and a pain clinic there. We see TBIs, strokes, spinal cord, MSK. We have a dedicated amputee clinic where our orthotists come in to work with us. We're starting up a continuity clinic, so the patients that we see as residents on the inpatient side will be following them along. That's going to be starting up hopefully in September. For our pain rotation, we get to work in the fluoroscopy suite, doing epidurals, medial branch blocks, radiofrequency ablations. In our MSK clinic, we get to use Botox as well as Dysport. We are the main people in charge of managing baclofen pumps in terms of refilling them and kind of troubleshooting issues along the way for these patients. Here's a few of the residents in our fluoroscopy suite on our pain rotations. In our outpatient area, we have a dedicated cardiac rehab unit. It's mainly focused for phase 2, 3, and 4 cardiac rehab, so helping these patients improve in their METs, their Bruce protocol, and their exercise tolerance along the way. On the first floor of that outpatient Brazza Center, it's more MSK focused, physical therapy and occupational therapy. As residents, you get to work out in the gym for free, so it's something that quite a few of us do. One of the chiefs, Chris, and I just had a workout session at the end today, right before this call tonight. Also on that first floor, we have dedicated lymphedema therapists. So some of our cancer patients or those with chronic lymphedema can get the care that they need there. We also have separate neuro outpatient gyms, so more focused to spinal cord injury, strokes, and brain injury as well. We have our car transfer area, but if a patient is driving a pickup or a larger vehicle, we ask family to bring that by so that we can train them prior to discharge. In terms of our children's rotation, so we have 2 required months for our peds rehab. You can, of course, use an elective if you're more interested in pursuing a career there. We have a 14-bed CARF accredited inpatient peds rehab unit. We have a very robust consult service and multiple clinics that are multidisciplinary with neurosurgery, with therapists, with urology, with EMGs in our plexopathy clinic. In terms of the procedures, we do baclofen pumps. We have mixed pain and spasticity pumps that we manage. We do sideline access as well for these patients. In terms of our injections, we can do Botox and Dysport. We do salivary Botox. We do anatomical guidance, EMG guidance. When we're under anesthesia, we do some phenol injections with eStim. And if you are interested in doing stuff more in the OR, you can work with the neurosurgeons with intraoperative monitoring for selective dorsal rhizotomy, and then follow those patients as they come to the inpatient rehab unit. Our consult service. So we have a pretty robust trauma patient population as well as a burn population. So you're going to be dealing a lot with that on your consult service, but you'll see a wide variety of other patients. Our consult attending has this saying where we're not just rehab docs working on if a patient is stable to come to inpatient rehab, but we're also physical medicine docs. So we spend quite a bit of time in our amputee patients, kind of teaching them, kind of helping them along the way in terms of the process coming up and working towards preparatory prosthesis and getting a prosthesis. Same thing, we work very closely with the surgery team and the burn attendings in terms of positioning and preventing contractures prior to coming to inpatient rehab or going to outpatient rehab. In terms of residents, so majority of our calls and holidays are taken by 2s, less so by 3s, and even less by PGY 4s. In our call room, we have 2 screen computers with Dragon dictation equipped on all of them. In terms of our EMR at RIM, we use PowerChart Cerner. We have a TV, a fridge, and then we have a dedicated call room with a bathroom and a shower in it. Every academic semester, we get a meal card to use at the Harper Hospital, where there's Thai food, Greek food, Indian, Middle Eastern, sushi, and soups. There's a lot of coffee options, as well as some Chick-fil-A, Subway, Wendy's, and Happy's Pizza in the hospital campus. We have free covered parking in the Skybridge. So if you don't want to go outside in the winter, you don't have to. You can go directly from the parking lot directly into the Rehab Institute of Michigan. In terms of our rotations, we follow ACGME accreditation in terms of everything that is required. We do quite a bit of 10X. Regenerative medicine is starting to pick back up with the sports med rotation. We talked about fluoroscopy and procedures with our pain rotation. We have a mixed inpatient and outpatient rotation for rheumatology. We have a dedicated month for more neuromuscular clinics in our neurology rotation. With our orthopedic surgery rotation, we're mainly focusing on weight bearing and what we can gain as physiatrists by working hand in hand with the orthopedic surgeons. You get to spend some time in our scoliosis clinic with Dr. Bazzi, and if you're lucky, you get to join him in the OR to work on a scoliosis case as well. As I mentioned, our main activity at the VA is EMGs, and we have 2 months dedicated to that. It's kind of your intro to EMGs before you kind of do more on the outpatient basis with some of our alumni and our other faculty with more outpatient PM&R. One of the things that the residents have implemented since I started as a PGY2 is a more formal block didactic curriculum. So we start with a PGY Bootcamp and kind of work through everything that's going to be tested on our board exams. And I think that it's been an improvement overall for the residents as a whole. With the pandemic, a lot of it was virtual, and we're going to a mixed system now as we're kind of moving to a post-pandemic time. So here's a few pictures of us in our anatomy class. Two of the alumni, Mr. and Mrs. Dr. Seidel, dedicate their time. So this fall will actually be an EMG course, and then the following fall will be an anatomy class. So this past year, we had our anatomy course, and this is a few of us working in the cadaver lab, looking at the extensor compartment of the forearm, kind of just working through MSK anatomy. Here's a few of us just kind of practicing EMGs and nerve conduction studies as a part of our didactic curriculum. We have now started a dedicated ultrasound curriculum as part of our didactics as well. So every few weeks, every month or so, we go through a specific joint. So here's some pictures of us going through the shoulder. And it's just helped us a lot in terms of our diagnostic MSK ultrasound skills, so that by the time you get to sports or some of your outpatient rotations, you're more confident doing injections. So the rest of the pictures on these slides are the residents not only in the hospital, but outside the hospital. We've tried to make a point to, stay balanced as we can in this pandemic era. We have created a sand volleyball team. We call ourselves the Reflex Slammers, and it's just something that gets us out and out of the hospital and just working together and building that camaraderie, which has been amazing for all of us. Here's pictures of the current PGY4s and a few of the prior graduates. And in terms of after residency, it's about half and half. Some of us go into fellowship and some of us go directly into practice. We have matched into PEDS fellowship, brain injury fellowship, spinal cord, pain, sports, and cancer rehab. We offer pain fellowships and sports medicine fellowships here at the Detroit Medical Center, if you're interested in that. We do have residents that go directly into practice. One of the prior residents is now one of our attendings here, who will be kind of leading the continuity clinic. And then we have prior alumni, as I mentioned, who come back and teach us during our didactic curriculums. So we're going to open up to questions. Feel free to follow us on our Instagram. And if you have any specific questions about applying or anything with that process, feel free to reach out to our program coordinator, Miss Amy Alamon. But I will stop sharing now, and we'll open it up to questions. So feel free to type stuff in the chat, and if any of the other residents who are on want to start to answer some questions, feel free to. Thanks, guys.
All right, thank you so much. You have about 7 minutes and 50 seconds left. So if you have access to the chat box, I'll let you read those and answer as they come, and we'll go from there. Can you see some of those questions, Dinesh?
Yeah, I can see some of them. Do some of the other residents, like Mike, do you want to start taking a few of these?
Yeah, sure, I could answer some of these. So I'm not from Detroit. I was actually raised in Florida, North Florida to be exact. When even just coming here for an interview, downtown Detroit really surprised me. There's so many things to do, lots of different little neighborhoods that got scattered around the city. Very eclectic vibe, a little bit of something for everyone. The food is great, tons of culture. We have an area more sort of like Middle Eastern called Dearborn. There's a midtown with lots of bars and places to go out. There's even this area called Eastern Market that does almost like a large, almost like farmers market, sort of, local vendors every weekend with like some roadside barbecues and Jamaican festivals. So culturally, it's so diverse. You can find a niche sort of within the greater Detroit area for whatever you're interested in. Even if you have a family, sort of the suburbs that got scattered around Detroit from everything that happened in the past is very developed and really nice, so you sort of have that suburb vibe outside of the main city as well. So yeah, I've really enjoyed the past year living here. You really can't complain, even with COVID going on.
Yeah, I'll speak to that as well. Coming from New York, Detroit has really been a surprise for me just in terms of the food scene. There's always a different restaurant I love going to and exploring with the other residents. There's a beach nearby. So me and Mike, actually, we go kayaking. We were just there over July 4th weekend, doing some barbecuing as well. And there's just a lot of activities just for outdoor stuff, especially during the summer. There was a question about call here. So call, I'm currently on call now. As you can tell, it's pretty chill for the most part. You know, during the week, you start from 5, go to the next day about 8. And as a PGY2, you'll have about 33 calls a year. It goes down to 27 as a 3, and then as a 4, there's about 20. And every year, there's just less and less weekend calls as well, more Thursday calls. So it gets better as you go on. There was a question about moonlighting. So moonlighting, you can start as a PGY3, and there's different opportunities available. There's a PM&R physician who can take some residents to work in his clinic. And then there's other opportunities like doing IMEs as well, as part of a private company that I've been able to do.
You have 4 minutes and 30 seconds.
Okay. That's all the questions, Dinesh, if you want to try and address some more of these.
Yeah, Faria or Shelby, do you want to try to attack some of these ones as well?
Sure. So there's a question about using OMT and OMM. It's actually a good question for Mike. But we've got a good mixture between MDs and the DOs. So just recently, a few of the residents who are DOs, they actually put a whole 4-hour lecture series for us to go over some OMM techniques, which was really good. So there's definitely crossover, and there's a lot of learning that we do from each other, which is a really good opportunity. What is the commute like every day? I think I live the furthest out, so I'm from Farmington Hills, which is about half out. It takes me half an hour to get down to downtown. It's not that bad, especially with COVID. Traffic has been really light for the past year, but even when there has been traffic, it's not been terrible. So I would say it's totally fine if you want to live a little further out. You don't have to live in the city. Let's see, with all the interaction with other professions, how often do you mingle with residents in the program side of the hospitals? This is a good question because I'm actually part of the resident council. We're looking over the whole resident body at DMC. And we just had our meeting today where we talked about setting up more like wellness events with residents from all the different specialties so that we can all interact with each other, kind of get to know each other. So it's not just the PM&R residents, you know, talking to themselves. So we're trying to set more things up with COVID. Hopefully us getting past COVID, we're gonna, you know, set up more sports events and other opportunities for us to get together.
I think someone was asking about sports coverage. Shelby is our sort of extraordinaire when it comes to that. So I don't know if she wanted to touch base on all the sports coverage that she's been doing with the local Detroit teams.
Sure, yes. So I've had an opportunity last fall, which is quite limited because of COVID. A lot of the high school sports weren't really playing anything, but I did get the chance to cover a couple JV football games. It also kind of coincides with the time that we are in that anatomy course and will be in the EMG course this fall. We usually do that on Fridays over the fall. So that does kind of impact, especially if you want to do varsity like football games in the fall. I've also been going to the wheelchair basketball kind of practices.
You have 2 minutes left.
Okay. And then just recently, just kind of working with the Sports Med Fellows, I've been able to go to Detroit City Football Club is the professional or semi-professional, I guess it's professional soccer team. And I've covered a couple men's and women's games recently. So opportunities are definitely starting to pop up more now that COVID is kind of hopefully on the back burner. But there are opportunities, you just kind of have to seek them out.
I recently volunteered at the Detroit Grand Prix, and as a PGY2, I also got to volunteer at the Detroit Marathon. So those are also opportunities that hopefully, as this pandemic comes to a close, more and more of those big city events will be coming back for us to volunteer at.
I kind of wanted to address one of the questions about improvements in the last year or so that was happened to the program. I know the chiefs from last year put a lot of work into scheduling our didactics into blocks. So it would be, you know, a stroke block versus just kind of, I think in the past had been kind of intermittent. You might get a lecture on stroke and then you might get a lecture on, you know, neurodegenerative disease or something like that. So they've really kind of grouped them together. And this year we're planning on doing a lot of kind of board prep as we, you know, kind of covering high yield topics as we go, you know, as we get closer to the SAE. So I think that's a positive move, but the chiefs are always working to improve things, you know, here and there as we see areas that could use improvement.